Hi, so my name is Dory, and I have Alphal Gal. And I was trying to figure out the other day, a friend of mine was diagnosed, and I was trying to figure out what to suggest to have with them and for them on the daily, like in their kit, like in their back pocket for reactions. So I wanted to quickly go through the things that have worked for me. I've had Alphal Gal for 4 years, and I am sensitive to dairy and gelatin and magnesium stearate, and as well as mammal. So I'm pretty sensitive when it comes to meds. So these are the things that have worked for me. Again, I'm not a medical doctor. It's just simply a suggestion of what would I do for a friend of mine. So the first step, I would get a container. A friend of mine got me this from 31, which is very cool. I also like this guy. It's probably about 8 inches wide, but it's insulated, so I recommend that. The first thing I would do, get an EpiPen. This is the old, I like to call it old school EpiPen. As you can see, I have an EpiPen container, Dory's EpiPen, pretty clear. I've got a plastic dollar store container in there that contains my EpiPens. I put them in there. I also have this protocol. Like, for example, in case I'm incapacitated and I can't talk, I can at least direct them towards it. And like it talks about how I have biphasic reactions, which means I have a secondary reaction, usually upon getting to the hospital, or a continuation of the first. I'm not sure. But I explain that here. Most of the time they don't look at it. But whatever, it's there, and I feel more comfortable in case I cannot speak. Another EpiPen option are the AveQ. This is the AveQ and what they look like. See, I never had to worry about this stuff in my life before, so this is all new to me. Well, 4 years new, but new. The AveQ, and this is the container I got also from Etsy, so it's like homemade. AveQ, the cool thing about them is they have a trainer.
This trainer contains no needle or drug.
So it walks you through the entire process, which is pretty cool. I like to have that with. I have this with, which is generic Benadryl. It is specifically the Equate brand from Walmart. I had called on this and it was safe. I still have had no problems with it. And like I said, I'm pretty sensitive. This is 25 milligrams of diphenhydramine. So that is basically generic Benadryl. And it's like $4 for 100 pills. The next thing I take is Unisom. As some people have problems with Unisom, I do not. So I don't, but then again, I don't really have problems with drowsiness. Benadryl and Unisom actually wake me up. This is what a Unisom looks like. It is a quick melt, so it acts a lot faster. That's why people use it. So you have a lot less time. Liquid is also ideally the best, but I find it difficult to transport / carry with me. This little pill is one of these. It's 25 milligrams of diphenhydramine. It says sleep aid on it, but it is diphenhydramine, 25 milligrams. So that is what I would also carry with me because I have airborne issues. That is not what I was reaching for. I have a Pro Air inhaler. My pharmacist checked on the generic because, of course, my insurance wanted me to get the generic. The generic Pro Air inhaler, we found out, has lactose in the mouthpiece. Why? Just why? I don't know why. So this is the Pro Air inhaler, and that's what helps me for airborne. Also, if I have to be somewhere where I'm starting to feel sick, usually I just leave the area, but sometimes I'll put this stuff on if I know I'm gonna have a hard time, if I'm having a rough day. Vogue mask. This is the 99. I like the Vogue mask. This particular one is super cool because it has Space Invaders on it. I mean, really, if you've got to wear something, why not make it cool? Or try to. That's pretty much it for the regular stuff. Oh, nope, forgot this. I also keep this with me because I do not present in the typical manner with hives. So basically what happens with me is I start feeling very, very sick and I get extremely confused. and I start like walking into walls and stuff. And that's really, really tough to explain. And then eventually I get to the point where I can't breathe and my throat starts to close. So this shows severe symptoms. So like if you have significant swelling of the tongue or lips, use the epinephrine immediately. Sometimes, and this is the FAIR, Food Allergy and Anaphylaxis Emergency Care Plan. I keep this with me also because sometimes hospital staff is really well versed on the significant swelling, but they're not so great on the repetitive vomiting and severe diarrhea. So it's stuff that you really, really kind of need to say, hey, this is really an allergic reaction, man. This is something serious. These show the mild symptoms also. Then you can fill in like your medications, your name, all that. But I just keep it with me and keep it blank. Make copies of it as need be. On the daily, I take, or after a reaction, I take prednisone. I'm sure I'm saying it wrong, but it's liquid prednisone. It is generally safe. I recommend having that with you. I looked for mine. Of course, I can't find it because that would be convenient. I have this prednisone. Hey, there we go. And it's compounded, so it's lactose free. It cost me about $80, which sucks, but it's in pill form, so I find it a lot easier to be able to carry it with me. And I take that with me in my kit for if I have an allergic reaction. As far as on the daily, to try to prevent, how do I say this? A histamine H1 and H2 blocker really kind of help a lot if you have alpha gal. So this ranitidine is a H2 blocker, and this is the NDC number at the bottom, and the manufacturer is Amneal. And my pharmacist has cleared that for me. Again, check with your pharmacist just to make sure. The other thing that I take on the daily is the H1 blocker, which is Allegra. Allegra, it's a little bit scary. There's been some recent back and forth on this, but Allegra has some pre-gelatinized starch, which basically apparently they use some gelatin in the processing of the starch, which as I understand it is usually corn. So I do not have any problems with this, and I have issues with gelatin, but if you have issues with corn, it may be a no-go, just so you know. Again, not everybody could take everything. So that's the basic stuff. I hope that helps. I hope that helps you to know what to have in your kit for your own safety. These are just suggestions of things that have worked for me, but I hope that those help out a lot. I'll talk to you later. Thanks.